What is the difference between craniotomy and craniectomy? Now, for explaining this, I have to explain a little of brain surgery. First of all, I am Dr. Gurneet Singh Sawhney. I am a senior consultant and head functional neurosurgeon at Fortis Hospital Mulund, Mumbai. So this is a question which is always asked for by a patient जो brain surgery के लिए जा रहा हो. The difference is subtle but big. So craniotomy means we remove one part of the bone, do the surgery on the brain and put the bone back and fix it with some mini plates and screws which are titanium. तो ये mini plate screws वहीं पर रहते हैं and the bone is fixed back. Craniectomy मतलब we remove the part of the bone, do the surgery and don't put the bone back. The skin is covering but that area is hollow. Now craniectomy is done, which is a very common procedure, is done when there is raised pressure in the brain. We call it as raised intracranial pressure. So patients जो trauma से आते हैं, accident से आते हैं, brain में bleeding हो जाती है, कोई भी acute condition होती है, where patient is in coma, then this procedure is a life-saving procedure. The reason is that any injury to the brain will give rise to swelling, like any injury anywhere else. Now, if there is injury in the hand, there is going to be swelling. Now, यहाँ पे हड्डी अंदर है, तो swelling आने की जगह है. लेकिन if there is injury to the brain, because the skull is outside, there is no place for the skull to have its swelling happening. So what does the brain do? The brain presses over the normal brain, and when the brain stem or the small brain और छोटा दिमाग उस पर प्रेशर जाता है तो पेशेंट कोमा में जाता है and patient की लाइफ को खतरा होता है. Now that should not happen. That's why we remove the part of the bone so that the swelling can happen outside and doesn't go inside. Now this is what is the difference and between the craniotomy and craniectomy. Both the procedures are very important in our neurosurgical practice and both give very good results. So you don't need to worry about any brain surgery because the brain surgery is well advanced now. And we here are able to handle all kinds of brain surgery. Thank you.